Hello student, now we are going to discuss ventilation perfusion of lungs. So in this session what we are going to discuss, first we are going to discuss normal ventilation and perfusion ratio. Then we are going to discuss regional distribution of ventilation, how the ventilation is differ between apex, middle part and base of the lung, that we are going to discuss. Then we are going to discuss ventilation and alveolar gas composition, that if the ventilation perfusion ratio is changing, how the gas composition of the alveoli will change. And then at the last we are going to discuss perfusion zones of the lung. Different zones are there depending on the perfusion level, so that we are going to discuss, and at the end we are going to discuss few MCQ. So first we are going to discuss normal ventilation perfusion ratio, the concept. Okay, so whenever we talk about ventilation and perfusion, we all know that the ventilation means it is the normal airflow inside the lung, and the perfusion means it is the normal blood flow inside the lung. So ventilation is normally denoted by the word letter V, and the perfusion is normally denoted by the letter Q, right? So whenever we say VQ, so it is a ventilation perfusion. Now whenever we talk about ventilation, we have to understand two different types of ventilation in lung. One is known as the pulmonary ventilation. So the pulmonary ventilation is also known as the minute ventilation. So you have to remember this name. The pulmonary ventilation is also known as the minute ventilation. So from the word you can easily understand that the pulmonary ventilation is talking about the total amount of ventilation in 1 minute, right? So how we are going to get the amount of pulmonary ventilation? So simple thing is that if you take one single breath, how much air you are taking inside your lung, that is a tidal volume, right? We all know approximate 500 ml of atmospheric air. So if you multiply this tidal volume with your respiratory rate, okay, which is normally 12 to 14. So tidal volume is the volume of air which is going inside your lung in one breathing, and if you multiply this with your respiratory rate, then you are going to get the total amount of air that is entering in your lung in 1 minute, and that is known as the pulmonary ventilation or minute ventilation. So simple, if you multiply this to normal value, it will be approximately 6 liter per minute, right? So the pulmonary ventilation normal volume value is 6 liter in 1 minute. Now we all know that whatever amount of atmospheric air you are taking in inside your lungs, suppose you are taking a tidal volume of 500 ml, all that atmospheric air is not reaching at the level of your alveoli for exchange, because in the previous chapter we have seen a concept of dead space. So that's why there is another ventilation concept you have to learn, and that is known as the alveolar ventilation. So from the name you can easily understand that the alveolar ventilation speaks about the total amount of air which is reaching at the level of alveolar zone or exchange zone of the lung. So how we are going to get this alveolar ventilation value? So simple thing is that tidal volume is the total amount of air that you are taking in inside your lung in one breathing minus the dead space volume, So if you subtract this dead space volume from tidal volume, what you are going to get? You are going to get the volume of air which is reaching at the level of your exchange zone or alveolar zone. So if you multiply this with your respiratory rate, then you are going to get the total amount of air that is reaching in your alveoli in 1 minute, and that is known as the alveolar ventilation. So simply, if you put the normal value of all of this, the tidal volume is approximately 500 ml, and then if you put the dead space volume of 150 ml and the respiratory rate is 12 to 14, then you are going to get approximately this is 4.2 liter per minute. So the value of the alveolar ventilation is 4.2 liter per minute, whereas the value of the pulmonary ventilation is 6 liter per minute. Now whenever we talk about the ventilation perfusion ratio, what do you think? Which ventilation we should consider? We should consider about the pulmonary ventilation, or we should consider the alveolar ventilation? Please remember, whenever we are speaking about ventilation perfusion of the lung, we are mainly concerned about the alveolar ventilation, because that is the air which is going for the exchange at the level of the capillary blood. So that's why whenever we speak about ventilation perfusion of the lung, we are talking about alveolar ventilation rather than pulmonary ventilation, which has a value of 4.2 liter per minute. Now whenever we talk about the perfusion of the lung, okay, so perfusion means I told you the blood flow at the level of lung, Now whenever we talk about blood flow of the lung, we all know that it is the right ventricle which is pumping blood, and that blood is entering in the lung, means the perfusion or the blood flow of the lung is equal to the cardiac output of right ventricle. It is nothing but the cardiac output of right ventricle. So whatever blood is ejected by the right ventricle in 1 minute, all the volume of the blood has to pass through the lung, because lung has no autoregulation. It cannot refuse that the whatever blood is pumped by the right ventricle, I am not going to take it. The lung has to take all the blood which is pumped by the right ventricle, and lung has no autoregulation. It cannot regulate its own blood flow. So you have to take the whole blood, and that is equal to the cardiac output, and we all know that the normal cardiac output is 5.4 liter per minute. So normal value of ventilation is 4.2 liter per minute, and normal value of perfusion for the lung is 5.4 liter per minute. So that's why we always talk about the ventilation perfusion ratio, or the VQ ratio. So this is 4.2 upon 5.4, so it is approximately 0.8. So that's why we say that the ventilation perfusion ratio of the lung normally is 0.8. But please note down that this 0.8 is the average value of the ventilation perfusion ratio of the lung, mainly in the middle part of the lung. So we just understood that what is the normal value of ventilation of the lung, what is the normal value of perfusion of the lung, and we have divided these two numbers and we are getting a ratio. But that ratio, I told you, this is the average ratio, and this average ratio is normally seen in the middle part of the lung. Now whenever I am specifying middle part, we can easily understand that the ventilation perfusion ratio will not be equal in different parts of the lung. Like for the apex and the base, it will be different. So how the ventilation perfusion ratio is different in different part of the lung, that we are going to discuss with this next topic, that is the ventilation perfusion in upright posture. Okay, and it is written in resting condition. So why we are using the upright posture? So when the person is on lying down posture, okay, then the ventilation perfusion ratio is almost equal in different part of the lung, starting from apex to the base. But whenever the person is an upright posture, the VQ ratio will be different in apex, middle part and base of the lung. That we are going to discuss, that why it will be different. Now whenever you are in upright posture, whether in the sitting posture or in the standing posture, remember what is happening in your lung. So try to understand this diagram which I have already made. So this is the diaphragm. So diaphragm, onto the diaphragm the lung is sitting. So this red color one is the parietal pleura, and we have already seen that the parietal pleura is normally attached with the bones and the muscles of the chest wall. So this is fixed with the chest wall, right? So this is the cross section of the ribs and the muscles. So this is fixed with the chest wall, and inside this parietal pleura, the visceral pleura along with the lungs are sitting. So this is the visceral pleura covering the surface of the lung, and this black color structure means this is the lung sitting inside the visceral pleura. Now whenever the person in upright posture, the gravitational effect on the lung will be there. Okay, means this lungs which is sitting inside this parietal pleura, these lungs are the freely mobile structure, right? So your parietal pleura is fixed, it is the fixed with the chest wall. You are in upright posture, but the lungs which is there inside your parietal pleura, these lungs along with the visceral pleura, it's a mobile structure. It can go up and down depending on the gravitational effect. So when the person is in upright posture, the gravitational force will pull the lung in the downward direction. So the gravitational force is pulling the lung in the downward direction, but the chest wall is already fixed. So the chest wall is already fixed with that of the parietal pleura. So the chest wall is already fixed with the parietal pleura. So what is going to happen? As if the lungs are going in the downward direction. So means the diaphragm is there, and onto the surface of this diaphragm, as if the lungs are sitting over this diaphragm. So whenever this kind of scenario is happening, what is going to happen? The volume of the basal interpleural space, the volume of the basal interpleural space and the volume of the apical interpleural space will be different. Why it is going to be different? Just now you have understood that the lung has been shifted in the downward direction. So the lungs are sitting over the diaphragm. Whenever the lungs are sitting over the diaphragm, so the basal interpleural space will be compressed and the apical interpleural space will be stretched. So I can easily imagine from there that the apical interpleural space is stretched and the basal interpleural space is compressed. Now whenever this kind of scenario is happening in the upright posture, what is going to happen? The interpleural pressure is also going to change in different parts of the lung. Why interpleural pressure is going to change? Because we have seen earlier that the interpleural pressure depends on the pressure volume relationship. So if the volume is expanding, what will happen to the pressure? Pressure will be more negative. So normally we have seen that the interpleural pressure have seen how much is the normal interpleural pressure, minus 5 centimeter of water, and that is at the middle part of the lung, that is at the middle part of the lung. When the person is in upright posture, because the apical interpleural press is more stretched, so the interpleural pressure in the apical space will be more negative. This is near equal to minus 10 centimeter of water, and in this condition at the level of the base the interpleural pressure will be minus 2.5 centimeter of water. Getting my point? So because of the upright posture, the gravitational effect is there, and because of the gravitational effect the volume of the apical interpleural space is more, that's why the pressure is more negative. The volume of the basal interpleural space is less, that's why the pressure is the less negative. Getting my point? So there is a difference of the interpleural pressure from the apical region, from the middle region to the base of the lung, more negative in the apical region. Now interpleural pressure, it's a negative pressure. What is the advantage of the negative pressure? Could you recall? I told you the negative pressure is a stretching force on alveoli. It keeps the alveoli open in a stretched condition. So if it is more negative pressure, so the stretching force on alveoli will be more, and if it is less negative pressure, then the stretching force on alveoli will be less. So alveoli are like balloons. The stretching force on alveoli in the apical region is more. So what happens? The balloon are going to be more stretched in the apical region. So the largest size of alveoli is going to be seen in the apical region because the balloons are more stretched. The interpleural space is less negative in the basal region, so the balloon will be less stretched in the basal region of the lung. That's why if you look at the size of the alveoli from apex towards the base, you are going to get a smaller and smaller size alveoli towards the basal region from apex. So from this thing, one important concept you have learned, that the largest size alveoli you are going to see in which part of the lung? The apical region of the lung. And if you go from the apical region to the basal region of the lung, the size of the alveoli is going to be reduced gradually. Why the largest size alveoli in the apical region? Because more negative interpleural space. In which condition? In upright posture. Please note down that if the person is on lying down posture, then this kind of variation is not going to be there. Almost equal size alveoli will be seen in different part of the lung. Now this concept that we have just got in this diagram, that the size of the alveoli is largest in the apical and the basal region is the smallest size alveoli. This is in which condition? When the person is holding his breath in resting condition. We have seen the resting condition means if you hold your breath at the end of normal expiration, that is the resting condition. So imagine that this diagram of the alveoli that we have made here, this is in the resting condition of the lung. The person is holding his breath at the end of normal expiration. Now suppose the person is starting its inspiration. So the person is taking inspiration. So inspiration means there will be expansion of these different parts of this parietal pleura, because the diaphragm is also going in the downward direction and the external intercostal muscle is also contracting. So what is going to happen? There will be expansion of this thoracic cavity. So whenever there is expansion of the thoracic cavity, what we have seen, that this interpleural pressure is going to be more negative during inspiration. So whenever the person is taking inspiration, the interpleural pressure will be more negative, means the pressure which is minus 10 centimeter here, it will be more negative, and the pressure which is minus 2.5, it will also become more negative. So everywhere the pressure, interpleural pressure is going to be more negative. Now if the pressure is becoming more negative, we all know that these alveoli are going to be stretched because of this negative pressure. So the alveoli are going to be stretched because of this negative pressure. Now if the negativity is changing equally in all part of this alveoli, all part of this interpleural space, which alveoli will be more stretched? Now here you have to understand in a clear mind. So in resting condition, the alveoli are already stretched in the apical region, and the basal region alveoli are not that much stretched. Okay, so you imagine two balloons, one of the balloon is already expanded, already stretched, and one of the balloon is not that much expanded, little expanded. Now you are giving equal amount of force in both of these balloon. One is already stretched and one is not that much stretched. So if you give equal amount of stretch in both of these balloon, which balloon is going to expand further? The loose balloon, because the loose balloon means it has enough space for expansion. So even if you give a little amount of force, it is going to expand hugely. But the balloon which are already stretched, like that of the apical alveoli, they are not going to be expanded further because it is already stretched. So whenever the person is taking inspiration, the negativity will be there in every part of this interpleural space, but this equal amount of negativity is going to pull the alveoli, but which alveoli are going to be expanded more? The basal alveoli, because that is smaller in size already. So whenever these basal alveoli are expanding more, so now we have understood that the apical alveoli are going to be less stretched and the basal alveoli are going to be more stretched or more expanded during inspiration. So I can easily write down here that during the process of inspiration, so whenever the person is taking an inspiration, there will be expansion of both alveoli, the basal alveoli also and that of the apical alveoli also. But if you look at the expansion, of basal alveoli expansion is much more than that of the apical alveoli, because basal alveoli are in resting condition, they are smaller in size, and the apical alveoli in resting condition, they are already stretched in condition. So that's why during inspiration the apical alveoli are not that much expanding, but the basal alveoli are expanding hugely. So during inspiration you are taking a tidal volume of 500 ml. So you are taking a tidal volume of 500 ml atmospheric air. So this 500 ml air is going to be distributed in your apical part of the lung, the middle part of the lung and the base of the lung. But what do you think? Major part of the tidal volume is going to enter in which part? The area where the expansion is more, and where the expansion is more, the basal part. So that's why most of the air which is entering during this tidal volume, they are going to be distributed in the more expanded zone of the lung, and that is the basal part. And that's why we say that the ventilation, that the ventilation is maximum in which part of the lung? The base of the lung than that of the apex of the lung. Got it? So this is very important concept, that ventilation of normal lung is maximum in which part? The base of the lung than that of the apex of the lung. Why it is more base at the lung? Why it is more in the base? Because the expansion of the base is more. Why the expansion of the base is more? Because the alveoli are more compliant, they can easily expand it. That is known as a more compliant alveoli. Okay, so the compliance of the base is more, that's why expansion is more, and because of the more expansion it is taking up more air, ventilation is more. Got it? So this is first concept, the ventilation is more in which part? The base of the lung. Now we are talking about the perfusion. So I told you perfusion means it is nothing but the blood flow. So the heart is located here, heart is pumping blood. So the blood is going to flow in the apical part of the lung, the blood is going to flow in the middle part of the lung, and it is also going to flow in the basal part of the lung. What do you think? If the heart is pumping with same amount of force, the blood will be distributed in different zones of the lung, but the maximum blood is going to be distributed in which part? Obviously, because the person is in upright posture, the gravitational effect is going to take part, and because of the gravitational effect, the maximum blood or the significant amount of blood is going to flow in which part of the lung? Base of the lung. So this is easy to understand, that's why we write down that the perfusion of the lung in resting condition. So the perfusion of the lung is maximum is again in which part of the lung? The base of the lung rather than that of the apex of the lung. So please note down, this is very crucial information. In resting condition, okay, in normal condition, when the person is in upright posture, so not in the supine posture, maybe in the sitting or in the standing posture, what is going to happen? The ventilation is also maximum in the base of the lung, and the perfusion is also maximum at the base of the lung. But you all know that even in the upright posture, if you calculate the ventilation perfusion ratio, VQ ratio is maximum in which part of the lung? Apex of the lung. So now this has changes everything. So now we are understanding that if the question is the ventilation is maximum in which part of the lung, or the ventilation per unit lung volume is maximum in which part of the lung, in both the cases answer is base of the lung. And the perfusion is maximum in which part of the lung, again your answer is base of the lung. But whenever the question is ventilation perfusion ratio is maximum in which part of the lung, your answer is apex of the lung. Okay, now we have to understand why the VQ ratio is maximum in the apex. To understand this concept, I have put some number here in this table. So look at here, the apex of the lung, the middle part of the lung and the base of the lung. Here is the ventilation in liter per minute and the perfusion in liter per minute. So if you look at this different number, ventilation 2 liter, 4 liter, 6 liter in different part of the lung, and the perfusion is 0.6 liter, 5 liter and 10 liter in different part of the lung. So I can easily understand from this number that the ventilation is less in the apex and more in the base. Same for the perfusion, it is less in the apex and more in the base. That means if you move from base towards the apex, the ventilation is also reducing and the perfusion is also reducing. Now if you look at this number, these numbers are the projected number. You don't have to remember this number particularly, okay, because this projected number means if all the part of the lung behave like that of the base, then the total amount of ventilation of the lung, total amount of alveolar ventilation of the lung will be 6 liter. But we know that the total amount of alveolar ventilation is approximate how much? 4.2 liter. That is the middle part. So middle part is the average, right? But if the all part of the lung behave like that of the base, then the total alveolar ventilation of the lung will be 6 liter, higher than normal value, okay. And if the all part of the lung behave like that of the apex, we know the apical ventilation is less, then the total ventilation of the lung will be 2 liter, okay. So that is the projected number from the actual number, right? And same for the perfusion, the total perfusion of the base is 10 liter. This does not mean that 10 liter blood is flowing in the lung, but it's indicate that if the all part of the lung behave like that of the base, then the total amount of blood that can accumulated by the lung is a 10 liter. But on an average, what is the normal value of perfusion of the lung? 5 liter, okay. So these are the projected number, you don't have to remember. But if you look at this number, then I am finding out that if I take a ventilation perfusion ratio of the lung, if I move from base towards the apex, so I am taking this ratio of ventilation perfusion at the level of apex. So I am calculating the VQ ratio at the apex of the lung. What I am finding out that the ventilation is also reducing at the apex and perfusion is also reducing at the apex, means at the level of apex ventilation is also lesser, perfusion is also lower. But if I look at this two number, that the ventilation is reduced from 6 liter to 2 liter and the perfusion is reduced from 10 liter to 0.6 liter. So which one is reduced more in the apex? Ventilation is also less, perfusion is also less. But if you look at this number, you are getting an impression that ventilation is also reducing, perfusion is also reducing, but which number is reduced more? The perfusion. That means in this ratio, the denominator is lowered more, the denominator is lesser than that of the numerator. So at the level of apex, the perfusion is reducing more than that of the ventilation, and because of this the ratio become highest, So what will be the answer if the question is why the VQ ratio is maximum at the apex? Your answer will be that at apex, ventilation also reduces, perfusion also reduces, but perfusion reduces more than that of the ventilation. Perfusion reduces more than that of ventilation. And because we are taking a ratio, the denominator of the ratio is reducing more than that of the numerator. So what will happen to the ratio? The ratio will be maximum. So that's why we all know that although the ventilation is also less in the apex, perfusion is also less in the apex, but VQ ratio is maximum at the apex. And what is the actual ratio? So just divide this number 2 with the number 0.6. So what will be the ratio? So 3.3. So at the level of apex, the VQ ratio is 3.3. At the middle part of the lung, the VQ ratio is average, that is 0.8, and at the base of the lung, the VQ ratio is 0.6. Just divide this two number, you are going to get this VQ ratio. So now this third column, that is the VQ ratio, you have to remember this VQ ratio normal value. So what is the normal VQ ratio at the apex? 3.3 maximum. What is the normal VQ ratio at the middle part? 0.8, and the VQ ratio at the base 0.6. So we have already discussed that normal VQ ratio of the lung, normal VQ ratios of the lung is 0.8. I told you repeatedly that this is the average ratio, and the average value you are going to get in which part of the lung? The middle part of the lung. When the person is in upright posture, there is an extreme condition in apex and extreme condition in the base. In extreme condition in the apex, the ratio is maximum 3.3, and at the base the ratio is 0.6. So this is the concept of VQ ratio in different parts of the lung that you have to remember. Now after understanding the different VQ ratio, we have to understand that what is the relationship between VQ ratio an alveolar gas composition, that if the VQ ratio is changing, what will happen to the composition of the gases of the alveoli region, right? So, region and ventilation at the level of apex. So, whenever we are looking at the level of apex, we have already seen that at the level of apex, what is the VQ ratio? VQ ratio is 3.3. Try to look at this ratio once again and try to understand what is the meaning of this ratio. So, VQ ratio is 3.3 at the level of apex. Forget about other part of the lung for the time being. We have already seen the ratio is maximum at the apex, that is 3.3, minimum at the base, that is 0.6. Now you concentrate only on apex. So at the level of apical alveoli, the ratio is 3.3. What is the meaning of this 3.3? 3.3 means ventilation upon perfusion is 3.3, means ventilation is 3.3 times more than that of the perfusion. Try to imagine once again. So at the level of apex, so this is the alveoli. What is the meaning of this? The alveoli are very larger in size, that we have already understood. So this is a very large alveolus at the level of apex, and the blood flow or the perfusion at the level of apex is very less. So that's why the diameter of this capillary is very thin, and through this capillary, which kind of blood is reaching? We all know that through this capillary, the venous blood is reaching at the level of this alveoli. But this alveoli has a VQ ratio of 3.3. That means the ventilation is 3.3 times than that of the perfusion, means ventilation is less here, perfusion is also less here. But if you compare between this ventilation and perfusion, then ventilation is 3.3 times higher than that of the perfusion, means whatever amount of blood is reaching here, that is the perfusion, the ventilation is 3.3 times higher than that of the perfusion. Now, if the ventilation is 3.3 times than that of the perfusion, what is going to happen? The scenario will be like that of a hyperventilation condition, means ventilation is rising but perfusion is not rising, that is like that of the hyperventilation scenario. So hyperventilation scenario is happening at the level of apical alveoli. What it means? It means there is more entry of fresh atmospheric air into this alveoli. So oxygen entry which is happening in the apical alveoli, that is total amount is less, but whatever amount of oxygen is entering at the level of alveoli, that ventilation is 3.3 times than that of the perfusion, means whatever oxygen is entering in the apical alveoli, all that oxygen is not going to be transported or exchanged at the level of capillary. Why? Because ventilation is huge in comparison to perfusion, and whatever amount of blood which is reaching at the level of this apical alveoli, this blood volume is also lesser. So oxygen is entering in the alveoli in huge quantity, but all that oxygen is not getting chance for exchange in the capillary blood because the volume of the capillary blood is also less, and the oxygen which is entering in the alveoli, that is also higher. So what will happen? More oxygen is going to stay behind at the level of alveoli. So more oxygen is going to stay here. So what will happen to the partial pressure of oxygen at the level of alveoli? It is written P capital A. This capital A indicate this is alveolar oxygen concentration. P for the partial pressure, capital A is the alveoli, O2 is the oxygen. So partial pressure of oxygen, what will happen? It will be higher, not only higher, it will be highest among any region of the alveoli starting from apex to the base. So try to understand once again. So at the apical alveoli, the ventilation perfusion ratio is 3.3 times. It indicates the ventilation is more in comparison to perfusion. If the ventilation is more, what is going to happen? Fresh oxygen is going to enter more inside the alveoli, but all that oxygen is not going to be exchanged at the level of capillary blood because the blood flow is very lesser. So more amount of oxygen is going to stay inside the alveoli, and the partial pressure of oxygen is going to be increased, and that increase of partial pressure is how much? That is highest among any region of alveoli. So now if I ask you, what is the normal value of partial pressure of oxygen in the alveoli? Could you tell me? Okay, so please remember that if you look at the middle part of the lung, I told you middle part of the lung means that is the average. That is the average. So whenever the person is in upright posture, even if you look at the middle part, then the middle part will give you the average value of everything. So at the middle part, if you look at the partial pressure of oxygen, that is normally 100 to 104 millimeter of mercury. So this is the normal partial pressure of oxygen in the alveoli. If I ask you what is the normal partial pressure of carbon dioxide at the level of alveoli, so that is 40 millimeter of mercury. And what is the normal pH of the capillary blood in the middle part of the lung, the capillary blood which is supplying the alveoli in the middle zone of the lung, that is a pH of normal, that is 7.4. So this middle part of the lung means this is everything is the normal value, it is normal value, and this is the average value, right? Now in comparison to the middle part, if you look at the apex, I told you that the apical alveoli means the oxygen partial pressure is highest. So highest means the middle part has an oxygen partial pressure is 100 millimeter of mercury. If you look at the apical region, it has a partial pressure of oxygen which is 132 millimeter of mercury. Looking at the number, you can easily understand that the in upright posture or in sitting or standing, whatever you say, in that condition, the apical alveoli has highest oxygen tension or highest oxygen partial pressure, and how much that is? 130 millimeter of mercury. Could you relate something? One question generally appears that why the tuberculosis infection is more common in the apical alveoli. This is the reason. Tuberculous bacilli is a strictly aerobic bacteria. Tuberculous bacilli is a strictly aerobic bacteria. So whenever the bacillus is entering in your lung, it will be delivered in the apical region, middle part and the base of the lung. But if you look at the oxygen tension, it is highest in which part of the lung? Apical region of the lung. And because these tubercular bacilli are strictly aerobic, they will easily survive in the apical alveoli, and that's why tuberculosis is very common or more common in the apical region of the lung than that of the other part. Getting my point? So this is first thing. Now looking at the carbon dioxide tension in the alveoli in the apex. So what is the source of carbon dioxide inside the alveoli? Where from this carbon dioxide is coming? We all know that this carbon dioxide is coming from this venous blood. So the venous blood which is delivered at the level of this alveoli, this is the source of carbon dioxide. So at the apical alveoli, the amount of carbon dioxide that will reach in the alveoli will be lesser. Why? Because this venous blood flow is lesser. So if the blood flow is lesser, then the carbon dioxide partial pressure or the carbon dioxide concentration will be lesser in the alveoli, plus the ventilation in the alveoli is far beyond than that of the perfusion. What is means the apical alveoli is a kind of hyperventilating. So if the person is hyperventilating, what happens to the carbon dioxide? We all know that carbon dioxide will be easily washed out from the lung. So in the apical alveoli, this carbon dioxide will be easily washed out, okay, and the amount of carbon dioxide which is reaching in the alveoli, that is also lesser, and that carbon dioxide is easily washed out from the alveoli also. Because of these two reasons, I can easily understand that if you look at the partial pressure of carbon dioxide at the level of apical alveoli, it will be very lower, and not only lower, it will be lowest. So the partial pressure of carbon dioxide is lowest in the apical alveoli, and partial pressure of oxygen is the highest in the apical alveoli. Highest means what is the number? 132 millimeter of mercury, and lowest means what is the partial pressure of carbon dioxide in the apical alveoli? That is 28 millimeter of mercury. What is the normal value? I told you just now, I have shown you just before this, that is 40 millimeter of mercury. So in the apical alveoli, the carbon dioxide tension is only 28 millimeter of mercury. Got it? Okay. So in the apical alveoli, the venous blood which is reaching here, this venous blood is easily delivering the carbon dioxide to the alveoli, because the partial pressure of carbon dioxide in the alveoli is very lesser. So the amount of carbon dioxide which will be present in this capillary blood which is leaving the alveoli, so the carbon dioxide tension of this capillary blood which is leaving the alveoli, means this is the blood which is ultimately going at the level of the systemic circulation. So what will happen to the partial pressure of carbon dioxide in that blood? It will be very less, because all the carbon dioxide has been delivered at the level of alveoli. So because the carbon dioxide tension is very less in the capillary blood which is leaving the apical alveoli, the pH, what will happen to the pH? pH will be alkaline in nature, that is 7.51. So what is the pH of the capillary blood which is leaving the alveoli in the middle part of the lung? We have seen normal pH is 7.4. So in the apical alveoli region, the pH of the capillary blood will be little alkaline, that is 7.5. I hope all of you got this concept. So apical alveoli means when the person is in upright posture, the apical alveoli are largest in size, but if you look at the VQ ratio, that is the highest. Because of the highest VQ ratio, partial pressure of oxygen is the highest and partial pressure of carbon dioxide is the lowest. And because the partial pressure of carbon dioxide is lowest, the pH is little bit alkaline. Got it? So this is apical. Now whenever you have understood apical region, it will be easier for you to understand what is going to happen at the base of the lung. Okay, so regional ventilation at the base of the lung. What is the VQ ratio? We have already understood that the VQ ratio is 0.6. What do you understand by the VQ ratio of 0.6? I can easily understand that VQ ratio 0.6 means perfusion is more and ventilation is less in the basal alveoli. So at the base of the lung, the scenario is different. The huge amount of blood is reaching through this venous blood. Huge amount of blood is reaching at the level of this alveoli, and the ventilation which is entering in the alveoli is less. So oxygen entry is lesser in comparison to perfusion or in comparison to blood flow. So if the oxygen entry is lesser, then what happens to the partial pressure of oxygen? Partial pressure of oxygen will be lesser. And if you think of that whatever amount of oxygen is reaching in this alveoli, can this oxygen be exchanged at the level of the capillary blood? Easily. Why? Because the blood flow to this alveoli is very huge. That's why the oxygen exchange is going to happen easily. So the oxygen exchange is going to happen easily. All the oxygen, almost all the oxygen which is delivering at the level of this alveoli, all that oxygen will be exchanged at the level of capillary blood, because capillary blood flow is very huge. Okay, so if most of the oxygen which is reaching in the alveoli is exchanged at the level of capillary blood, what is going to happen to the partial pressure of oxygen at this alveoli? So the partial pressure of oxygen at this alveoli will be lower. Not only lower, it will be the lowest. Okay, and normal partial pressure of oxygen is 100. So here in this alveoli will be 89 millimeter of mercury, right? And think of the carbon dioxide. So I told you already what is the source of carbon dioxide. It is coming from the capillary blood only. So if the blood flow in the basal alveoli is very high, then the carbon dioxide which will be delivered at the level of this alveoli, it will be very huge, and that huge amount of carbon dioxide will not be able to go out of this lung easily. Not very easy wash, not easy wash out. Okay, if there is no easy wash out, why there is no easy wash out? Because the ventilation is lesser in comparison to perfusion. So if the carbon dioxide is not easily washing out from the alveoli, which is reaching at the level of this alveolar gas, so what happens to the partial pressure of carbon dioxide in this alveoli? The partial pressure of carbon dioxide in this alveoli will be very high. Not only high, it will be highest. And how much that will be? That will be 42 millimeter of mercury. So normal value is 40, here it will be 42 millimeter of mercury. Got it? So please note down that basal alveoli means the partial pressure of oxygen is lowest and the partial pressure of carbon dioxide is highest. Now if the partial pressure of carbon dioxide is highest, so what is going to happen? The carbon dioxide tension in the capillary blood which is leaving the alveoli will be very high, and if the carbon dioxide is high, what will happen to the pH? pH will be a little acidic, that is 7.31. So this is the pH of the capillary blood which is leaving the alveoli. Which alveoli? The basal alveoli. Now one thing, okay, so at the level of the base of the lung, huge amount of blood is flowing at the level of this alveoli, but all the blood is not going to get saturated with the oxygen. Why? Because the oxygen tension is less here. So blood flow is very huge, and all the blood which is reaching at the level of basal alveoli, the blood is coming to the alveoli. What is the purpose of this blood? Because the blood is going to leave the carbon dioxide and it is going to take up the oxygen. But the blood flow amount is so huge that all the blood, all the venous blood which is reaching here, they are not going to get proper oxygen. So I can understand that at the base of the lung, some of the blood which is coming in this alveoli is not going to get proper oxygen. Means this venous blood will reach here, but it will not get oxygen and it will bypass to the other side. Other side means that is the arterial side. So I can easily understand that at the base of the lung, certain amount of venous blood is not going to get proper oxygen and it is directly bypassing from the venous side towards the arterial side. So this is known as the shunting of venous blood from venous side to the arterial side because of the huge blood flow in the base of the lung. Getting my point? Getting the concept? So the venous blood which is reaching in the alveoli, what is the basic purpose? It has to deliver the carbon dioxide to alveoli and it has to take up the oxygen. But because the oxygen entry in the alveoli, basal alveoli is so less and the blood flow is so huge that some of the venous blood will be delivered directly from the venous side towards the arterial side without any proper oxygenation. And whenever the blood is directly shunted from venous side to the arterial side, that is known as the shunting of the blood. So please note down that at the base of the lung, there is shunting of blood. At the base of the lung, there is shunting of the blood. And if you look back at the apical alveoli, in the apical alveoli, this shunting is not going to happen because here the blood flow, venous blood flow is very less. Means all the blood is going to get proper oxygenation. But even after proper oxygenation, some of the oxygen is going to stay in the alveoli. Means the amount of oxygen entry which is happening in the apical alveoli is so huge that some of the oxygen is not going to get exchanged at the level of the capillary blood. So what is the basic purpose of the oxygen entry in the alveoli? The basic purpose of the oxygen entry is to deliver the oxygen to the capillary blood, but some of the oxygen which is entering in the apical alveoli is not exchanged with the capillary blood. That means this oxygen, extra oxygen which is entering, that is wastage. Okay, lung is not utilizing that oxygen because you are taking the oxygen in the alveoli, but you are not taking this into blood. So there is wastage. So that's why we say that at the apical alveoli there is a little wastage of ventilation. There is a little wastage of ventilation, and whenever there is wastage of ventilation, some amount of air is entering in the alveoli, but that alveolar air is not taking part in gas exchange. What we call it? We call it as alveolar. We call it as alveolar dead space. So please note down that at the apical most alveoli, if you look at the extremes of the apex of the lung, then few alveoli will be there where some of the gas is entering in that alveoli, but that gas is not getting oxygenated. That gas is not exchanged at the level of capillary blood. So that amount of air, that amount of gas which is entering in the alveoli, that air will be known as the alveolar dead space. But I already told you, but normally in our lung there is no such alveoli where alveolar dead space is there. Alveolar dead space is almost zero. So that's why I'm saying, so this is not a normal phenomena, but in extremes of the lung, you may get few of the alveoli where alveolar dead space may be very little, negligible. We ignore this amount of dead space. So that's why you say alveolar dead space is zero. But this can happen at least theoretically. Getting my point? So please note down that apical most, extremes apical most alveoli, there is certain wastage of ventilation, and that is equal to the alveolar dead space. And extreme base of the lung means certain amount of venous blood will be delivered from venous side to the apical side, that is known as the shunting of the blood. Got it? So this is the concept which is very important. So what is the bottom line? Bottom line is that if the VQ ratio is higher than 1, we have seen that if the VQ ratio is 3.3, then what is happening? Partial pressure of oxygen in the alveoli is very high and partial pressure of carbon dioxide is low. And if the VQ ratio is lower, 0.6, we have seen in the base, okay, then what is happening? Partial pressure of oxygen is low and partial pressure of carbon dioxide is high. This bottom line you have to remember. So this is typically happening at the level of apical alveoli, and this is typically happening at the base of the lung. Okay, so with this concept that if the VQ ratio is greater than 1, then partial pressure of oxygen rises, and if the VQ ratio is lesser than 1, partial pressure of oxygen decreases. With this concept, we are going to understand one pathological condition, that what will happen to the VQ ratio in certain pathological condition. Two pathological condition we are going to understand with this simplified diagram. So this is a schematic diagram to show you that suppose this is an alveoli, not alveoli. Suppose this is a group of alveoli. Got it? Okay, so suppose this is a part of the lung, okay, or maybe this is one alveoli, whatever, and this is another alveolus, and this is the capillary blood which is supplying it. Now we are going to imagine two extreme scenario. One extreme scenario is that suppose there is an obstruction to the airflow to this alveolus. Means suppose one foreign body or suppose one tumor is blocking these smaller size bronchioles to this alveoli, so the airflow is blocked, no ventilation in this alveoli. So in this condition, if I ask you that what will happen to the VQ ratio in this alveoli. So first you think of that what will happen to the VQ ratio in this alveoli where foreign body or tumor is completely blocking the airflow to the alveoli. So I can easily understand ventilation is 0 but perfusion is maintained. So 0 upon something is equal to 0. So whenever my VQ ratio is equal to 0, what is going to happen to the gas composition of this alveoli? That we are going to understand. And in other side, we are going to understand another extreme scenario where one embolism is completely blocking the blood flow to this alveoli. Okay, so suppose there is an embolism is blocking the blood flow to this alveoli. So whenever embolism is blocking the blood flow, so what will happen to the VQ ratio in this alveoli? So in this condition, the air is going to enter inside this alveoli, but the blood is not going to reach at the level of this alveoli. So the ventilation is normally continued, but perfusion is equal to 0. So ventilation certain number upon 0. So something upon 0 is infinity, means in this alveoli where embolism is completely blocking the blood flow, VQ ratio of this alveoli will be infinity. So one condition extreme where VQ ratio is 0 and another condition is extreme where VQ ratio is infinity. We are going to understand what is going to happen to the alveolar gas composition in the first case and the alveolar gas composition in the second case. That is our understanding. Okay. So in the first case, whenever tumor is blocking the airflow to this alveoli, it is very easy to understand that no fresh air is going to enter in this alveoli. So if no fresh air is going to enter, what is the partial pressure of oxygen in this alveoli? 100 millimeter of mercury, and the venous blood which is going to reach in this alveoli, venous blood, what is the composition of the venous blood? We all know the partial pressure of oxygen in the venous blood is 40 and partial pressure of carbon dioxide is 46. This is the composition of the venous blood. So initially, suppose the obstruction has happened just now, right? Okay, just now this obstruction has happened. What is going to happen? The partial pressure of oxygen in this alveoli is still 100 millimeter of mercury, and the venous blood which is reaching here, what is the partial pressure of oxygen in that? That is 40 millimeter of mercury. So initially this oxygen exchange will continue, but more oxygen is entering from this alveoli to the blood. What will happen to the partial pressure of oxygen in this alveoli? The partial pressure of oxygen will gradually decrease, maybe 60, maybe 80, maybe 60. Okay, so gradual decrease in partial pressure of oxygen in the alveoli, and the blood is taking that oxygen more and more. But whenever the partial pressure of oxygen in this alveoli will reach a value of 40 millimeter of mercury. Okay, so partial pressure of oxygen in this alveoli is 40 millimeter of mercury, and the venous blood which is flowing in this alveoli, it also has a partial pressure of oxygen which is 40. So whenever both the partial pressure of oxygen is 40 means the blood which is reaching here, it has a partial pressure of oxygen is 40 and the alveoli gas has a partial pressure of 40. Both the partial pressure are equal. Do you think the oxygen exchange is going to happen in this condition? Answer is no. We all know that the process of oxygen transport here is by process of simple diffusion. Simple diffusion requires the difference of partial pressure. If the partial pressure of oxygen is same in both the zone, no further oxygen exchange is going to happen. So this is the point where the partial pressure of oxygen in the alveoli is 40. At that point, no further oxygen exchange is going to happen. Okay, and we all know that already the alveoli is obstructed, so fresh oxygen is not going to enter here. Now what about carbon dioxide? Same thing. So initially the partial pressure of carbon dioxide is 46 here, and in the alveoli partial pressure of carbon dioxide is 40. So initially the carbon dioxide will be delivered into this alveoli. So more the carbon dioxide delivered, what will happen? The carbon dioxide partial pressure will go on increasing, and whenever the partial pressure of carbon dioxide in this alveoli is 46 millimeter of mercury, the venous blood also has a partial pressure of 46. So at that condition, no further carbon dioxide is going to be delivered in this alveoli. So whenever the alveolar gas composition, okay, whenever this alveolar gas composition has a partial pressure of oxygen which is 40 millimeter of mercury, so this is the partial pressure of oxygen, and the partial pressure of carbon dioxide which is a 40, partial pressure of carbon dioxide, which is a partial pressure of 46 millimeter of mercury, that is the point where no further diffusion or exchange of gases is possible in this alveoli. Means this is the condition what is going to happen whenever any foreign body or tumor is obstructing one alveoli. Means the alveolar gas composition. So the bottom line is that alveolar gas composition, okay, is exactly equal to, is similar to venous blood gas composition. Getting my point? So if you look at the alveolar gas composition, partial pressure of oxygen is 40, carbon dioxide is 46. Same for the venous blood, 40 and 46. So that's why we say that whenever your VQ ratio is 0, then the alveolar gas composition is similar to venous blood gas composition. Now we are going to plot this concept in a graphical representation. So look at this graphical representation. So this graph denoted the partial pressure of oxygen in the alveoli in x-axis and partial pressure of carbon dioxide in alveoli in y-axis. I repeatedly told you that this capital A denotes this is the alveolar gas composition. So whenever your VQ ratio is 0.8, that is the normal VQ ratio. Whenever the VQ ratio is 0.8, normal VQ ratio, okay, what is the partial pressure of oxygen in this condition? I told you VQ ratio 0.8 means that is the average ratio. Average ratio is seen in which part of the lung? Middle part of the lung. At the level of middle part, what is the partial pressure of oxygen? 100 millimeter of mercury. At the middle part, what is the partial pressure of carbon dioxide? 40 millimeter of mercury. So in this graph, if you want to plot this for 100 and 40, so partial pressure of oxygen is 100 and carbon dioxide partial pressure is 40, means if I take a point here, this point indicate that this has a VQ ratio of 0.8. Getting my point? So what is the meaning of this point? Meanings, if you look at this point has a partial pressure of carbon dioxide is 40 and partial pressure of oxygen is 100 millimeter of mercury. That is a VQ ratio 0.8. So this is the VQ ratio 0.8. Got it? Now, just now we have understood that whenever our VQ ratio is 0, what will be the composition of this alveolar air? Partial pressure of oxygen is 40, partial pressure of carbon dioxide is 46. So look at, so partial pressure of oxygen is 40 and partial pressure of carbon dioxide 46. So you take one perpendicular on this point and you draw one perpendicular on this point. So the junction of these two perpendicular means if you take a point here, this point indicate, okay, this point indicate that the partial pressure of carbon dioxide is 46 and the partial pressure of oxygen is 40. So this is the alveolar gas composition when my VQ ratio is how much? When my VQ ratio is 0. That means from this 0.8, if you move towards this VQ ratio of 0, means if the VQ ratio is decreasing more and more towards 0, from 0.8, your VQ ratio is decreasing towards the 0. Your VQ ratio is decreasing towards 0. What is happening? Your oxygen is decreasing, you are going in this direction. What is happening? Your oxygen is decreasing, and what is happening to the carbon dioxide? Your carbon dioxide is increasing. That concept we have already seen, that if the VQ ratio is lesser than 1, then what will happen? Oxygen will be lesser, carbon dioxide will be higher. Got it? And if we go in the opposite direction, that is the VQ ratio infinity, what is going to happen? That we are going to understand here. So now you look at the other extreme scenario. What is that other extreme scenario? One embolism, okay, is blocking the blood flow to an alveoli. So what is going to happen? Atmospheric air is going to enter in this lung, and this atmospheric air will be easily delivered at the level of this alveoli. No problem in the airflow to this alveoli. Okay. So what will happen to the partial pressure of oxygen and carbon dioxide? Whatever is the partial pressure of oxygen and carbon dioxide at the level of this trachea or upper airway, that is a conducting zone. So if you look at the partial pressure of oxygen at the level of conducting zone, that is 140 millimeter of mercury, and the partial pressure of carbon dioxide is 0.3 millimeter of mercury. Where from these numbers are coming, you will understand later on. For the timing, you just remember that partial pressure of oxygen and carbon dioxide at the level of this upper airway conducting zone, oxygen is 149 millimeter of mercury, carbon dioxide is almost 0, that is 0.3 millimeter of mercury. So all that oxygen and carbon dioxide is going to reach at the level of this alveoli, okay, is going to reach at the level of this alveoli. But this oxygen and this carbon dioxide is not going to exchange with that of the capillary blood, because no blood is flowing here, okay. So the venous blood which is entering here, that is 0. So if the venous blood is not entering, no exchange of gas. No exchange of gas means, if you look at the partial pressure of oxygen at the level of alveoli, it will be same to same with that of the conducting zone region, that is 149 millimeter of mercury, and partial pressure of carbon dioxide is near equal to 0, that is 0.3 millimeter of mercury. Means the alveolar gas composition, is similar to which region? The conducting region of air. Conducting region of air is also known as the inspiratory air. So this is similar to the inspiratory air composition. Getting my point? So whenever one alveoli is devoid of any circulation, or whenever one embolism is blocking one alveolar blood flow, what is happen? The alveolar gas composition will be similar to the inspiratory air gas composition. And what is that? The partial pressure of oxygen is very huge, that is 149 millimeter of mercury, and partial pressure of carbon dioxide is 0.3, and this is happening with an VQ ratio of how much? VQ ratio of infinity. So if we want to plot in this scenario, so partial pressure of oxygen is 149 near equal to 50. So the partial pressure of oxygen is near equal to 50 and partial pressure of carbon dioxide is near equal to 0. Means if you take one point here at this region, this point indicate that it has a partial pressure of oxygen which is 150 millimeter of mercury and partial pressure of carbon dioxide is near equal to 0. So if you extend this VQ ratio curve here, okay, so this is the point where your VQ ratio is how much? Infinity. Getting my point? So if your VQ ratio is increasing from this 0.8 towards any ratio which is reaching about infinity, what is going to happen? The partial pressure of oxygen is going to rise and partial pressure of carbon dioxide is going to decrease. Getting my point? So on an average ratio of VQ is 0.8. From that ratio, if you go towards the infinity ratio, your partial pressure of oxygen in the alveoli will rise and partial pressure of carbon dioxide will reduce. And if you go towards 0, your partial pressure of oxygen will reduce and your partial pressure of carbon dioxide is going to increase. This is the meaning of this VQ ratio curve. Okay. So now we have seen the regional ventilation difference between apex and base, and we have seen the extreme condition. One extreme condition where foreign body is blocking the airflow to the alveoli, and in other condition embolism is blocking the blood flow to the alveoli. So if one embolism is blocking the blood flow to the alveoli, all the air is entering in the alveoli, but that air is not taking part in gas exchange. So what will be the name of this air? This air is typically known as the alveolar dead space. And we have already discussed that in case of embolism, in case of emphysema, alveolar dead space is positive. So this is one scenario where atmospheric air is entering in the alveoli, but it is not taking part in exchange. So this is alveolar dead space. And in other condition, there is no fresh airflow to this alveoli, but the blood flow is coming here, but that blood is not getting any oxygen and it is not delivering any carbon dioxide, because the alveolar gas composition is similar to venous blood gas composition. So all the venous blood which is reaching here, that is going to be delivered from the venous side towards arterial side without any oxygen exchange or carbon dioxide exchange. So whenever the blood is moving from venous side towards the arterial side, this is known as the shunting of blood. Getting my point? So whenever your VQ ratio is becoming more and more lesser towards the 0, the shunting of the blood volume will be increased, and whenever your VQ ratio is moving towards the infinity, your alveolar dead space will be more and more. Getting my point? So this is the bottom line concept. So this concept has been given here, that if the VQ ratio is 0, okay, partial pressure of oxygen is 40 millimeter of mercury in the alveoli, and partial pressure of carbon dioxide is very, very high, 46 millimeter of mercury. But whenever your VQ ratio is infinity, more the ratio, more will be the partial pressure of oxygen in the alveoli, that is 150 millimeter of mercury, and partial pressure of carbon dioxide is near equal to 0, that is actually 0.3 millimeter of mercury. So this is all about your VQ ratio summary and the concept that you require. Now at the end of this chapter, we are going to remember certain important points about pulmonary circulation. Okay, so we have already seen that blood flow to the lung is more in the base of the lung rather than apex, and that is due to gravitational effect. Now, what are the other points that you have to remember about pulmonary circulation? You know that pulmonary circulation means not only the pulmonary arteries supplying blood to the lung, pulmonary artery is a branch from the right ventricle. So, that is not the only blood flow. The pure oxygenated blood is also flowing through the bronchial artery into the lung, and this blood flow, bronchial artery blood flow, generally supply up to the level of, this is generally supply up to the level of respiratory bronchiole, up to the level of respiratory bronchioles are supplied by this bronchial artery. Getting my point? So trachea, bronchus, branches of the bronchi, they require pure oxygenated blood for the tissue survival, and this bronchial artery is a branch from the thoracic artery. So this is giving pure oxygen supply to the level of this trachea, bronchi up to the level of respiratory bronchiole. And the pulmonary artery, so this is the venous blood which is coming from the right ventricle, and this venous blood is reaching at the level of lungs for the proper oxygenation. So dual blood supply is there inside the lung. Then the second thing is that lung blood supply or lung blood flow has three important characteristics. What is the three important characteristics? It has low pressure. So if you look at the pressure at the level of pulmonary artery, that is very, very less in comparison to systemic artery. So low pressure zone in the lung. Low resistance. If you look at the blood flow, resistance, we have seen in systemic circulation, the blood flow, resistance to blood flow is very, very high, but at the level of lung, the resistance to blood flow is very, very less, because they are very easily stretchable. The pulmonary artery, the branches of the pulmonary artery, the pulmonary capillary, all of them are easily stretchable. So the resistance to the blood flow in the lung is also lesser in comparison to systemic circulation. So the low pressure, low resistance, but high capacitance. Just now I told you that this pulmonary artery and the branches of the pulmonary artery, they are very easily stretchable. More the stretchable, more is the compliance. So the compliance of the pulmonary circulation is very, very high. High compliance, low resistance, low pressure. These three important points you have to remember about pulmonary artery. Now there is a question that pulmonary vascular resistance and systemic vascular resistance, which one is the lower? Remember, pulmonary vascular resistance is very, very low. It is 1/10 of the systemic vascular resistance. Systemic vascular resistance is also known as the total peripheral resistance. So if you look at the total peripheral resistance and the total pulmonary resistance, so pulmonary resistance is only 1/10 of the systemic vascular resistance. And pulmonary vascular resistance falls with increase in cardiac output. Typical example, suppose one person is doing exercise. Okay. So when the person is doing exercise, what is going to happen? The cardiac output is going to be increased. If the cardiac output is going to be increased, what is going to happen to the blood flow in the lung? So blood flow in the lung is also going to be increased. Why? Because I told you already that cardiac output more means the right ventricle is pumping more blood. All the blood has to flow through the lung, because lung has no autoregulation. It cannot prevent the, or it cannot autoregulate its own blood flow. So whenever the cardiac output is increasing during exercise, there will be more blood flow to the lung. And if there is more blood flow, what is going to happen? Lung capillaries, lung vessels are very, very compliant. They are easily stretchable. There will be increase in diameter. There will be increase in diameter of the vessels of the lung. Okay, increased diameter. And whenever there is increased diameter of the vessels, okay, what is going to happen to the resistance? The pulmonary vascular resistance is going to fall. So this is the reason why there is decrease in pulmonary vascular resistance during exercise. More the blood flow, there will be more dilation, easy dilation of the capillaries, easy dilatation of the vessels inside the lung. Okay, so that is known as the recruitment and dilation. More number of opening of the capillaries will be there, and more dilation of the capillaries vessels is going to happen. So pulmonary vascular resistance is going to fall. Okay. Now after understanding this, the last understanding that you have to see is that there are different zones of pulmonary blood flow. Okay. So you just try to imagine that heart is pumping blood from this region. So blood is going to flow through this apical alveoli also. the middle part and the base of the lung also. But due to the gravitational effect, we have already seen that the largest alveoli is found in which region of the lung? We all know that the largest alveoli, largest size alveoli is seen in at the level of apex. So, whenever the alveoli are largest in size, means alveoli is hugely stretched. Whenever alveoli are hugely stretched, what is going to happen to the capillaries in between? Suppose these are the two alveoli, they are hugely stretched. So, the capillary which is present in between these two stretched alveoli, they are going to be compressed. So, more stretching of alveoli means we all know that capillaries, they are basically lining this alveolar wall. So, if the alveoli are stretched and both the alveoli which are near to one another, they are stretched. So, in between this tissue, in between this capillary, they are going to be compressed. So, at the apical most region of the lung, because the alveoli are hugely stretched, the capillary are going to be completely obstructed. So, look at the blood flow to the apical of the lung. What is the blood flow volume? The blood flow is less. The blood flow is less, low. So, blood flow is low plus capillaries are compressed because of the alveolar expansion. So, what is going to happen? The blood is not going to flow through this region of the capillary which is there in the extremes of apex. Why the blood is not flowing? Because in this region, the apical most region, okay, the alveolar pressure P capital A, alveolar pressure because of the stretching of alveoli is very huge than that of the pulmonary artery pressure, and pulmonary artery pressure is greater than pulmonary venous pressure. So, this V indicate this is the pulmonary venous pressure, this small a indicate pulmonary artery pressure and capital A indicate pulmonary alveolar pressure. So, whenever the alveolar pressure is greater than pulmonary arterial pressure also, then all the capillaries are completely closed, no blood flow is going to happen, and this is known as the zone 1 of lung, zone 1 of lung. So, zone 1 of the lung where it may appear. Why I am saying may appear? Because in our lung there is no zone 1. Zone 1 is not possible in our lung. Why? Because we all know that there is blood flow in all the capillaries. There is no such alveoli where blood flow is 0. No, that is not there in normal lung. So, zone 1 is not present in our normal lung, but zone 1 may be created when heart is pumping less blood. Why? Look at. So, why zone 1 is created? Zone 1 may be created in which part of the lung? Extreme apex. Why? Because in extreme apex the blood flow is less. Okay, in extreme apex the blood flow is less. So, because of the lesser blood flow, pulmonary arterial pressure is lesser. And because the alveoli are hugely expanded, alveolar pressure are more than that of the pulmonary arterial pressure also, and that is why no blood flow. So, in normal lung this scenario is not going to happen, but suppose there is heart failure, suppose heart is pumping less blood, in that cases this blood flow will be more lesser in comparison to normal lesser blood flow also. So, in that cases zone 1 may be created in pathological lung, but not for the normal lung. Okay. So, now look at the zone 2. So, in zone 2 that is normally seen in case of middle part in the apical and uppermost part of the lung, upper part and middle part of the lung has zone 2. Zone 2 means here the pulmonary arterial pressure is greater than pulmonary alveolar pressure, which is greater than pulmonary venous pressure. What is the meaning of this? Meaning is that this pulmonary arterial pressure means blood flow is little higher. Because of that, pulmonary arterial pressure is greater than that of the alveolar pressure, greater than that of the alveolar pressure. So, pulmonary artery can easily overcome the alveolar pressure, but this alveolar pressure is greater than the pulmonary venous pressure, means there will be a compression of this pulmonary capillary towards the venous side because venous pressure is lesser. So, in this condition, whenever heart pumps blood during systole, the blood flow is going to happen, but whenever the heart is not pumping blood, that is during diastole, the blood is not going to flow because this compression will be there. So, that is why this is known as the zone 2. What is going to happen in zone 2? Zone 2 means the pulmonary arterial pressure is more than that of the pulmonary alveolar pressure. So, it can overcome the alveolar pressure, but alveolar pressure is greater than venous pressure. So, alveolar pressure will be lesser than venous pressure, means the blood flow can happen only during systole when the heart is pumping blood, but blood flow is not going to happen during diastole, because during diastole this alveolar pressure, the arterial pressure will be lesser than that of the alveolar pressure. Got it? So, this is zone 2. So, zone 2 and zone 1 I will show you what you have to remember. So, zone 1 means the area of zero blood flow. It does not exist in normal lungs, but it can happen in pathological condition like for example heart failure. So, here the alveolar pressure is greater than arterial pressure, which is greater than venous pressure. Zone 2 means here the blood flow is intermittent. What do you mean by intermittent blood flow? Means blood flow occurs during systole of the heart, systole, but no flow during diastole. This kind of scenario is known as the waterfall effect. Waterfall effects. Okay. So, waterfall effect means the blood is flowing only during systole, no blood is flowing during diastole. That is the waterfall effect, which is seen in zone 2. Zone 2 normally seen in which region of the lung? The apex to middle part of the lung has zone 2. So, in my cases, from apex to middle part, that is a zone 2, means blood is flowing in which part? During systole of the heart, but blood is not flowing during diastole. Okay. And zone 3 means that is the pulmonary arterial pressure is very greater than pulmonary venous pressure, which is very greater than alveolar pressure. Means the arterial pressure as well as pulmonary venous pressure both are higher than alveolar pressure, because at the level of base we know that the alveoli are very smaller in size, and because of the smaller size alveoli, the alveoli cannot compress the pulmonary vein also, pulmonary artery also. Means the artery, vein are always open, means the blood flow will continue during systole and even during diastole, means continuous blood flow, and this is known as zone 3. So, what is zone 3? The zone 3 means you have to remember that zone 3 means the blood flow is always continuous, high blood flow and continuous blood flow. In normal lung, this is typically seen at the basal part of the lung, right? So, here the arterial blood pressure, pulmonary arterial blood pressure is greater than pulmonary venous pressure, which is greater than alveolar pressure. So, these 3 zone you have to remember. Sometimes MCQ can be given zone 1, zone 2, zone 3. So, zone 1 means that is an abnormal zone. Normally, it is not seen in our normal lung, but it can be created if the blood pressure, the pumping force of the heart is lesser, like for example heart failure. So, in apical and middle part, normally the zone 2 prevails, and basal part means zone 3 prevails. That is the scenario you have to remember. So, this is all about ventilation perfusion of the lung. So, we are going to discuss few MCQs. The first is the VA, that is the ventilation, alveolar ventilation. So, V for ventilation and Q for perfusion. Ventilation perfusion ratio is infinity. So, we have just discussed VQ ratio. Infinity means what will be the partial pressure of oxygen? It will be 150 I can say, or partial pressure of carbon dioxide will be near equal to 0, that is 0.3 millimeter of mercury. Okay, and no exchange of oxygen carbon dioxide is going to happen in this ratio. So, pressure of oxygen in the alveolar air is lesser than dead space volume. No, it is same to same with that of the conducting zone. So, this is not true. Partial pressure of oxygen carbon dioxide are equal. Obviously, this is not true. Partial pressure of oxygen is 159. This is not 159, 149, right? And partial pressure of carbon dioxide is 40. No, this is 0.3. So, this is also not true. No exchange of carbon dioxide and oxygen occurs. This is absolutely true. So, this is going to be my answer. Okay, getting my point? So, this kind of question they are giving. Ventilation perfusion ratio is maximum at, we all know that this is maximum at apex, that is 3.3 to 3.6 is the normal ratio at the level of apex. So, this is all about ventilation perfusion of the lungs. Thank you.